13 Home remedies to relieve constipation naturally. Constipation is one of the extremely common digestive problems. This condition can be caused by a poor diet, lifestyle, medication use, or other medical conditions. If not treated early, constipation can greatly affect the quality of life, as well as the general health of the patient. 1. Make sure to provide enough water for the body. When the body is often dehydrated, it can lead to constipation. Therefore, to prevent the risk of constipation, you should focus on providing and keeping enough water for the body. Constipation can be relieved when you quickly rehydrate the body, such as drinking carbonated water. Some researchers have found that carbonated water can reduce symptoms of constipation more than tap water. In particular, it is also very suitable for use by people with indigestion or people with chronic idiopathic constipation. However, you should not choose carbonated drinks that contain a lot of sugar, such as soft drinks, because these drinks often have potential health risks and can even make your mood worse. Your constipation becomes more severe. Some patients with irritable bowel syndrome have reported that their symptoms not only did not seem to improve but also showed signs of worsening after they drank carbonated drinks high in sugar. To limit the negative effects of carbonated water on your health in general, and on your constipation in particular, you should become a wise consumer in choosing healthy drinks. Health, for example, drinking carbonated natural mineral water. 2. Add more soluble fiber to cure constipation. Healthcare professionals often recommend that patients with constipation hold increased fiber intake through daily nutrition to cure constipation. In fact, providing a large amount of fiber to the body will help increase the consistency and volume of bowel movements, thereby making it easier for you to have a bowel movement. The results of a 2016 study showed that more than 70% of patients with chronic constipation had very positive signs of improvement when adding fiber from their daily diet. However, there are also some conflicting opinions from others. They found that increasing their intake of fiber made their constipation worse than before because dietary fiber only improved bowel movements, but did not relieve them. Symptoms of constipation, including abdominal pain, dry hard stools, and bloating. 3. Increase exercise. Many studies have shown that increasing exercise can help you improve the uncomfortable symptoms of constipation and make bowel movements easier. In particular, patients with IBS should practice moderate exercise, such as brisk walking, swimming, or cycling, which can improve digestive symptoms as well as quality of life. However, you should limit vigorous exercise, such as jogging, as they can make symptoms of constipation worse in certain cases. 4. Drink coffee. Some people feel that after drinking coffee, they feel more like going to the toilet. In fact, this is because coffee contains caffeine, which stimulates the muscles in the digestive system. Research has found that drinking caffeinated coffee can stimulate digestive muscles 60% more strongly than drinking plain water, and about 23% more than drinking decaffeinated coffee. In addition, coffee also contains a small amount of soluble fiber, which improves the balance of bacteria in the intestines and prevents constipation. However, caffeine may not be good for people with irritable bowel syndrome, as it can worsen digestive symptoms. Therefore, IBS patients should eliminate caffeine from their diet. 5. Use senna herbal laxative. Senna herbal laxative is recognized as safe and effective in curing constipation. This type of laxative contains plant compounds called glycosides, which stimulate the nerves in the intestines and speed up bowel movements. Although senna is considered safe for adults for short-term use, you should still consult your doctor if after a few days of taking the medicine there is no improvement in your symptoms. In addition, pregnant women who are breastfeeding, or people with inflammatory bowel disease should not use senna to avoid the potential side effects it causes. 6. Probiotic supplement. Probiotics is a type of beneficial bacteria that live in the intestinal tract, which has the ability to prevent chronic constipation. These usually include lactobacillus and bifidobacteria. You can get these beneficial bacteria through probiotic foods like sauerkraut, yogurt, or kimchi. For some patients with chronic constipation, there may be an imbalance between the bacteria living in the intestinal tract. Therefore, consuming a variety of foods containing probiotics will contribute to improving this imbalance and preventing constipation from occurring. A recent review found that taking probiotics for 2 weeks can help treat constipation, increase stool consistency and frequency. In addition, their ability to treat constipation also stems from the production of short-chain fatty acids, which improve bowel movements and make bowel movements easier. 7. Use of laxatives. Depending on the condition of constipation, each person will choose a laxative that is right for him, because laxatives are often different in how they work, but they all have a certain effect on the disease. Constipation. Here are some of the most common types of laxatives, including bulk laxatives. These are drugs with fiber, which help increase the water content of the stool. Stool softeners. An oil-based laxative that makes stools softer and easier to pass through the intestines. Osmotic laxatives. Helps soften stools by pulling water from surrounding tissues into the digestive system. Stimulant laxatives. Helps increase bowel movements by stimulating the nerves in the intestines. If you are planning on choosing any of these medications for your long-term constipation, you should consult with your doctor to find out which medication will work best for you. 8. Adopt a low FODMAP diet. In fact, constipation is a common symptom of irritable bowel syndrome. Therefore, nutritionists recommend that patients with constipation and IBS should adopt a low FODMAP diet, as it not only helps in treating IBS syndrome, but also improves related problems. Constipation. FODMAP stands for oligosaccharides, disaccharides, monosaccharides, and fermentable polyols. This diet generally recommends limiting the consumption of high FODMAP foods for a certain period of time, before reintroducing them in the daily diet. This is to determine which foods your body can tolerate. For people with IBS, just following the low FODMAP diet is not enough. They need to pay attention to many other aspects of the diet, such as adding enough fiber and water to relieve symptoms of the disease. 9. Supplemental glucomannan. Glucomannan is a type of soluble fiber, extracted from the roots of the konjac plant. It is considered an effective solution in preventing constipation. According to research, glucomannan helps improve intestinal motility, while balancing the beneficial bacteria in the intestinal tract due to the mechanism of action like a prebiotic. You can get this soluble fiber from supplements, or eat noodles, konjac, and shirataki. 10. Eat prebiotic foods. Prebiotics are a type of carbohydrate fiber that is difficult to digest, consisting of inulin and oligosaccharides. This type of fiber helps improve the health of the digestive system by strengthening the beneficial bacteria in the gut and improving the balance of the intestinal flora. And yet, prebiotics also increase the frequency of bowel movements and help soften stools. You can get prebiotics through foods like Jerusalem artichokes, garlic, leeks, chicory, bananas, onions, and chickpeas. 11. Magnesium citrate supplement. Magnesium citrate is an over-the-counter osmotic laxative that is very effective in treating constipation. Generally, you should only take moderate amounts of magnesium supplements to relieve symptoms of constipation. For surgeries, doctors will use them in higher doses to help clear the bowels before the patient begins surgery. 12. Eat prunes. Prunes are considered a natural solution to help cure constipation effectively. The reason, in prunes not only contains fiber but also includes sorbitol, a sugar alcohol with laxative effect. Even the fiber in prunes is more effective than other fiber like psyllium. You should use an average of about 7 plums twice daily to improve the symptoms of constipation. However, the sugar alcohols found in prunes are in the high FODMAP food category, so it may not be suitable for people with IBS. 13. Avoid using milk. People who are intolerant to milk, including adults who are lactose intolerant, and children who are intolerant of cow's milk proteins, should use them with caution, as it can affect bowel movements and cause constipation. For the above cases, it is advisable to remove milk from the diet, and at the same time increase the intake of calcium-rich foods to improve the symptoms of constipation. In case many ways to cure constipation have been applied, but it is not effective, the patient should go to the hospital to be examined and effectively treated by a specialist.